National Task Force on COVID-19 Special Advisor Dr. Tony Leachon recently expressed his disappointment over the health department's reporting of COVID-19 data. We now talk to Dr. Leachon himself live via Zoom. Good morning, Dr. Leachon. Thanks for joining us. Now, over the past few days, you've been very vocal about your disappointment with how the DOH handles and reports data. You've said that the agency has, and I quote, lost focus. What makes you say that, sir?
Well, as a team member, as well as an advisor to the National Task Force, we have seen the IATF and the National Task Force working very hard. And if I remember, I was at the palace on April 20, and there were three things that I told the president and the members of the cabinet, together with the former secretaries of health, that the most important thing is the generation of real-time and granular data, which may be important for decision-making. But there are, of course, backlogs and, of course, some delays in the reporting, which the Department of Health yesterday acknowledged this. Now, we demand, of course, extra effort coming from the Department of Health, since the data churned out by the department will be important in the decision-making of the IATF. And on a positive note, they have responded by explaining yesterday the number of deaths the other day. Number two, they have partnered with the University of the Philippines pandemic team. And yesterday, during their virtual presser, the University of the Philippines, led by Dr. Ted Herbosa, was with the Department of Health in explaining the data of the cases right now in the Philippines, cases, recoveries, and deaths. And moving forward, I think that particular call of action is just a call for better performance. And of course, this is, of course, in the service of the Philippines. We usually rise above these personal differences or challenges and to work for the higher goal.
Dr. Leachon, moving forward, what do you think the DOH should do to improve its reporting and to just really make it clearer to lay people to understand?
I think the Department of Health should be able to clean up the backlogs. They have to recruit more encoders, more epidemiologists, and enlist a lot of academic researchers, and work with the government's education system and research system, like the University of the Philippines. This is a problem that that is so huge that you need to enlist a lot of other people in order to make the response more agile, more timely, and more granular.
You've also said, Dr. Leachon, that there has to be some sense of urgency in terms of testing and contact tracing. Where are we on this? Do we have the capacity to do extensive contact tracing?
Well, right now, we've been working with the Department of Health and the Department of Interior Local Government, and we are making some, headway right now in terms of our establishment of the contact tracing process. We had about 3 workshops already with the local officials coming from Luzon, Visayas, and Mindanao. And I would say there's a silver lining in this, and we are very focused on this. Aside from, trying to use digital technology, aside from recruitment of 140,000 contact tracers, in order to isolate the sick and the healthy. The contact tracings will be the game changer in order to reopen the economy.
Doctor, you were in Cebu a few days ago, I understand, and we know that now Cebu City is the epicenter of COVID-19, at least certainly in the Visayas, if not the country. How would you describe the situation there?
Well, when we saw the data prior to our visit, we were there June 11 and June 12. That was the first time that we had an overnight stay in an area. So we decided to look for the data ourselves. We did the field work, and we divided the meetings into 2. Secretary Galvez went on to meet the the hospital owners and the business sector, together with Governor Gwendolyn Garcia and Secretary Michael Dino of the Office of the President for Visayas. And we, the medical team, went to meet the regional director, Dr. Jimmy Bernadas, together with the medical directors and other experts of both the public and private hospitals. Our findings, there were increasing cases, widespread local transmission of the barangays. We asked the medical directors and the experts of the private hospitals that the critical care utilization rate is right now at full capacity, meaning to say their ICU, the use of mechanical ventilators and isolation beds are actually at their max capacity. And with increasing cases, we assume that the hospitals will be overwhelmed, and we don't want to happen. And I agree with the president that an enhanced community quarantine will be the best solution to reduce the viral transmission while we improve the healthcare capacity to detect, test, and isolate and treat every case there. So that's about 15 days. I think the government should work with the business sector and the medical community so that this particular acute rise in cases in Cebu will actually be prevented and stopped.
All right, thank you so much for joining us this morning. That was National Task Force on COVID-19 Special Advisor, Dr. Tony Leachon.